Next thing we're going to look at is choking. There's two definitions of choking. There's mild airway obstruction and there's severe airway obstruction. So with mild airway obstruction, this is when the person can still cry, talk, cough and breathe. This is when it could be a situation somebody's eating and there's sort of like there's something beginning to get caught in their throat, almost like Houston, we've got a problem. At this point, the most important thing is to get them to remain calm, you to remain calm, and get them just to try and cough this out. Because it's still a point now they can breathe. It could go either way. We get them to cough, and out it comes. If it's full airway obstruction, severe airway obstruction, that's when they can't breathe, cry, talk, or cough at all. The airway is fully, completely blocked. They will be looking at you, eyes open, and nothing at all, no sound at all coming from the mouth. This is now a life-threatening situation, and you should get someone immediately to call an ambulance as you then start to be doing the up to 5 back blows if needed, and up to 5 abdominal thrusts if needed. And I'll show you how we do those, yeah? Statistically speaking, unlike the CPR that we spoke about earlier, the CPR, if you ever have to do that, will probably be on somebody you know. With the choking, it's a little bit different. Unless it's one of your children or grandchildren, it'll probably be on somebody you don't know. Like you're in a pub, in a cafe, in a restaurant, somebody starts to choke and you go, hopefully in to save the day. But you must ascertain, there's two things as we were talking about earlier on in the course about the Good Samaritan's law. You know, we must gain consent or implied consent, as well as stay within our skill set. So we will be bringing this into practice now. So with the next sentence, you're going to ask the person who's choking, actually ask them, are you choking? As much as it sounds a strange thing to ask. But one is, you want to ascertain they are actually choking. They're not just having a moment, something that they have, as well as you want to gain consent. They'll be like, yes, I'm choking. And if any sound comes from their mouth, you know it's still at mild form. If their mouth opens, nothing comes out, and they're like nodding their head, they are choking. Can I help you? Yes, they are choking. You've got consent, and you know at what level it's at. Yeah, does that make sense?
Yeah.
Any questions? No. Okay, so we immediately, let's say this person now, I know is choking, it's severe, I've asked them, no sounds come from their mouth, I've got consent, they've said yes. So I've then said to you, right, go and phone an ambulance for me straight away. I'm now going to be demonstrating the back blows. Yeah, so it will be up to 5 back blows done if needed. So what that would be, it'll be obviously you'll be standing up, the person will be standing up, unless they're really, really tall and you're short, then maybe get them to kneel down like this now that we're doing. Lean them forward, whether the hands are on the chair or on the back of the chair, or on the table, whatever it is, whether you're standing or kneeling. Your more dominant hand will come down and strike them in between the shoulder blades area. As it comes down, and at the end with a very slight upward movement, not a ricochet. It will come down with a very slight up. I'll demonstrate how hard on the floor here, because as you've seen earlier, the heads do fall off on these. So it will be something in the lines of, yeah, we have to get a certain amount of pressure and a blow to the back to get the desired outcome that we want. So after the first blow we've done, we've seen if anything's come out, ask anyone, anything come out? No. Yeah, plus they will let you know probably quicker than anyone, stop, I can breathe. So 2, up to 3, 4, 5 if needed. Hopefully it's cleared. If it hasn't, we will then get them to stand upright. I'll be standing up behind them. Make a fist. Your fist goes around them to here, to where you assume their belly button is. Roll the fist up. The fist now, my fist is bang in the middle between my belly button and under my rib cage, in the very soft part of the belly there, yeah? Your other hand will come around them, push in, and it's going to be like a J movement. We're going to go in, back, and up. So we're going to go in behind the rib cage, up behind the rib cage, under the diaphragm, push the diaphragm up to where the lungs are. And if there's any oxygen left in their lungs, it hopefully push the blockage out. No matter what the age of the person, if you have to do abdominal thrust, they must get medical attention immediately, whether it's the paramedics or the hospital, doctors and nurses, because this can be quite damaging inside. It could be cracked ribs, internal bleeding.
So that's why you do the back blows first?
Yes. It's the lesser of the two evils, and it depends where the blockage is. Back blows are good if the blockage is quite high up, and it saves so. Yes, you got it. But obviously, if it's lower down the blockage, we really then need to come to the abdominal thrust on that. Does that make sense?
Yeah.
So then what would happen, we'd come round, make the fist to where the belly button is, roll the fist up, hand around, and we will go in and under and back behind the rib cage up to 5 times if needed. If it still hasn't cleared, we'll then get them back up again, lean them forward, and we'd go back to the back blows again, up to 5 if needed, turn them around, and we just keep doing this till hopefully it clears.
Yeah.
Yes, exactly, on that. Is that okay? Any questions on that?
No.
Okay, so finish the choking. Now we're on to bandages and triangle bandage. We're looking at slings. So we've gone to, you have a cut on your arm, on your left arm. Let's say it's on the top coming down here, like so. So maybe I could say we're going to use pressure. I say, oh, because you are the patient, you can still use your other hand. Can you put your hand over there, please, and hold it tightly down? So I've then gone to my first aid kit. I've pulled out a bandage. A quick way just to make sure it's all still sterile. I can squeeze the bottom, no air comes from the top, turn it around, and it's still very airtight. So I know this is sterile inside, as well as obviously we have the dates on them. We open this up, and at the time I could be asking you, how did you do it? How are you feeling? I'm looking at your vital signs as well. So we can open this up now. So we get to the galls, and then I can open this also so it'd be shiny side down, so it's nice and slippery as it goes down onto the wound. So on the count of 3, I'll get you to remove your hand. 1, 2, 3, remove. And then this now, I'll start with the tail end, will come up, over, and back down. And I'll get you just to hold that if you don't mind. Because you can, yeah, obviously you're a patient, but you do have another hand to help me if I didn't have anyone else here helping me. So I'm now going to roll the bandage up over the galls at the top. And as you've seen, I've gone over the galls at the bottom as well. And ideally now I'm going to fix, that's it, the knot, tie the knot. It will then be, it was a bit too tight there. Let's do this way here. Directly above the galls itself to keep applying pressure going down on there. So let's say that's tight enough. Done. So it's covered the top, covered the bottom. Just to check as well, if you wasn't wearing nail varnish, I'd do the capillary refill on your fingernails, but as you have nail varnish, I'll just use your skin. I'll just squeeze your skin for about 5 seconds. 2, 3, 4, 5. Release. 1, 2, and the colours come straight back into it within a couple of seconds. So I know the bandage is not too tight. Yeah, does that make sense?
Yeah.
Perfect.
So if it was too tight,
yeah, what would happen is if it was too tight, when I released the pressure, it would take significantly longer to get the colour of your skin back or your nail back like so, because I've now turned this pressure bandage almost into a tourniquet. You got it, yeah, you got it. Okay, keep that on then for a souvenir. You can now put one of these on me. So there we go. So it's just here.
Sterile.
That's it. You can turn it that way. So there's still, that's it. No air escaping.
It's awkward.
Whoa, we got the strongest ones in the whole wide world.
Oh, where's the smoke?
There we go. Blood everywhere.
Yeah. So find the
galls. That's it.
Open it up.
That's it. So that'll go. That's it.
1, 2, 3.
That's it.
There we go.
So use that one.
That
Come
one.
down that way. Come down that way.
Are you holding that?
I'll hold that one there for you.
And then this one comes up. Yeah?
Yep, that's it.
And then I'll tie the knot
On the top.
on the top.
Remember, not too tight. That's it.
Yeah.
That's it. So you could double it up and then that's it.
And test your...
That's it. Keep it pressed down for 5 seconds.
Oh.
That's it. Let's come back to colour. Excellent. Well done.
Sure.
Yep. See, these don't have to be cosmetically pleasing on the eye as long as they're functional. They cover the top of the galls, cover the bottom. Perfect. Yeah. Lovely. So the next thing we're going to do is look at the triangle bandages.
Okay.
So have you ever put one of these on somebody before?
I don't think so.
Okie dokies. Well, I did one of these at a course a few months ago. I had some nurses in there, and when I was undoing the triangle bandage, for a split second or two, I got it slightly all over the place a little bit. And the nurse said to me, Paul, have you ever done using the triangle bandage using the knot to elbow technique? I said, no, what's that? She said, well, get the triangle bandage out, hold it open. Clearly, that's the top of the triangle bandage here. She said, put a small knot on in there, which I did. I then said to her, so what next? She said, Paul, what's it called? She did actually say that to me, knot to elbow. So I was like, oh, okay. So it really is knot to elbow, under, over, around, tie the knot, done. So it depends if we need it as an elevation to come up. I can tie this end, that's it, higher.
Yeah.
If not, it's very quick, very easy. The knot obviously holds the elbow in from falling out, as well as you know where to start. Knot to elbow, done. Does that all make sense?
Yeah.
Brilliant. Okay, I'll take that one off of you, and then you can use your one on me.
Okay. So, open it out. Top of the triangle.
Mm-hmm.
Knot in it.
That's it.
Knot to elbow.
Perfect.
Up the back.
So,
And the front. Tie a knot.
lovely. All done.
That's it. And if it needed